Hello, good afternoon, and welcome to our weekly COVID-19 virtual media briefing with Montgomery County Executive Mark Elridge, with our Health Officer, Dr. Travis Gales, and also with the participation of our Director of the Office of Emergency Management and Homeland Security, Dr. Earl Stoddard. And I am Lorna Virgili, Hispanic Public Information Officer for Montgomery County Government, and I will be your moderator today. For members of the media, please remember to use the chat. Ask for permission to record as we begin right now. And also, once we're ready for the portion of questions and answers, remember to identify yourself and the organization that you represent. And with that being said, let's get started with the County Executive, Mr. Elridge.
So good afternoon, everybody, on this pleasant, interestingly cool second day of fall day. I'll start with, case count information. We're reporting 69 new cases today and a test positivity rate of 2.2%. That number is a good number. We've issued or are issuing a new modified executive order. The primary changes involve religious gatherings, and it modifies our previous executive order that will allow for larger religious gatherings. The Montgomery County Public Health and Emergency Management team have worked really closely with members of the faith community working group to make sure we enhance or develop enhanced spacing allowances, but do this in a safe way. They've worked collaboratively to offset any increased risk of more congregants by including additional safety requirements and guidance for houses of worship. On the testing front, yesterday we tested 502 people. The day before we tested 599 people. We have capacity to do more testing. We need people to come in and get tested more. I'll reiterate again that the CDC guidelines still say that asymptomatic people, can get tested and should get tested. So we continue to encourage people to please come in and get tested. We need to know where the virus is in the community, and without testing, we don't know it, and when we do know it, we don't know it until somebody is actually presenting as sick, and that means there's a period of time when they're spreading and they don't realize that they're spreading. Today, there is county testing in 3 locations: Germantown, White Oak, and Silver Spring. Tomorrow we'll be testing in Germantown and Silver Spring, and of course there are other sites that are up and operating in the county, and you can go to our website to learn about the testing locations and the times. Where am I? And as I said last week, we continue to see a reduction in people coming in for testing, so I just want to reiterate that. That is not where we need to be. We need to be on an upward trend in people getting tested, and I want to please encourage you, if you're putting this message out, you're reporting what we're saying today, we're saying we really need people to come in and get testing. We have the test kits. We have many locations now, so please take advantage of it. We hope that people who are out a lot, are planning to travel, or have been in large gatherings recently, or work environments where you connect with people regularly, that you think particularly about the situations you'd be in. You are most likely the folks who do get exposed to the virus out there in the community. I've been tested. It was pretty quick and simple. So please go to our website, schedule an appointment, and get tested. And while you're scheduling appointments, go get a flu shot. I got my flu shot last week. It didn't even hurt the next day. So it was pretty painless, and it's really, really important we get as many people to take the flu shots, so we have as little confusion out there about who's got the flu and who's got COVID, and hopefully who doesn't have both. So again, please get a flu shot and take a test. I want to remind people of the importance of wearing a mask. This is still probably the most important thing you can do to keep yourself safe. Be aware that the CDC guidelines, for a brief moment, they actually put up what they thought, which is that you need to be that 6 feet isn't sufficient in terms of protection, that the virus can travel farther and longer, and so you need to be aware of that 6 feet isn't necessarily a foolproof barrier for you. We understand for political reasons that the guidance got taken down. We're hoping that it makes a new appearance on the CDC and it isn't too heavily altered. I'll say again, medical policy ought to be medical policy, shouldn't be political policy. So I dearly hope that at least people take that seriously. If the CDC thought enough to put that up there, we should all be aware of it as we move around the county and not just assume that 6 feet gives us a pass on wearing masks. I've talked about our Mask Up campaign that we're doing in partnership with Montgomery County Economic Development Corporation, Visit Montgomery, the local business community. The local business community has been really strong supporters of this. I mean, I will say they understand it's crystal clear that our ability to stay open depends on our ability to control the virus. They know that, even if I open the county, if virus is seen as out of control, people aren't going to go out shopping anyway. And so it is in all of our interests to get these numbers down and make us as safe as possible. And that's the purpose of our Mask Up campaign. And so we're asking people to wear masks in public and outdoors, and particularly when they're not able to maintain physical distance. I will say that I wear my mask even when I can maintain physical distance, because it's too easy to be going along and all of a sudden encounter somebody, start a conversation and forget, oops, I didn't have my mask on. So I find it easier just to wear the thing. Make sure it covers your nose and your mouth, and when you're out eating, please wear it while you wait for food and after you've finished your meal or drinks. And frankly, between taking bites or drinks of things, you should have your mask back on. As difficult as it is to adjust to wearing a mask, it has been the key to stopping the virus. It's not all that difficult. I mean, I've been doing this now for a long time. This is a worthwhile precaution that we're asking people to take. On voting and elections, we're a little over a month from Election Day. We've been encouraging people to vote by mail, and particularly to do the mail-in ballot and not the electronic ballot. The response has been tremendous. We are going to have hundreds of thousands of people voting by mail, and hopefully some number of them electronically, but not too many. As we've tried to explain before, the problem with the electronic ballot, the email ballot, is that it has to be transcribed from the email ballot onto a ballot the machines can read, which requires people to physically take the email ballot and then record the entries on another ballot, and then make sure there's also another person watching to make sure the entries are recorded properly. And this complicates and slows down the process. So as many of you who can submit mail-in ballots, please use the mail-in option. And you can request the mail-in ballot. You can choose, and please choose by mail. For people interested in who requested an internet ballot, they'll be sending them out today. The deadline is October 20th. For people who registered a vote by mail ballot, they'll be mailing early next week. And when you fill out the ballot, please remember to sign the affidavit on the envelope. Do not sign the ballot itself. I'm going to say that again. There's an affidavit on the envelope. That has to have a signature. If you don't sign that and only sign and put a signature on the ballot, your ballot may not get counted. So sign the affidavit on the envelope. For voters who choose to or who have to vote in person, early voting will run from October 26th through November 2nd. Our Board of Elections is working hard to make the voting experience go as smoothly as possible. If you vote in person, again, vote early to minimize the lines. Make sure you're wearing a face mask and stay 6 feet away from the person in front of you. On Election Day, November 3rd, voters will be able to cast ballots at any early voting center or public high school. There will not be the usual 200 plus voting sites on Election Day. So we want you to know this. There is, on our website, there is a map of all the voting sites. Do not assume that, in previous years they had a few early voting sites and then you went to your normal polling place. You will not be going to your normal polling place this year. Please consult the maps for where the polling places are, and if I remember correctly, you can vote at any polling site, so you're not going to have to vote at one that particularly assigned to your district. On Election Day, voters can cast ballots in person. There will be 39 voting centers in the county, all the early voting sites, all the high schools, plus the White Oak and Nancy Dasick North Potomac Recreation Centers and the North Bethesda Conference Center will be additional voting places. Residents can vote at any of these voting centers. Yesterday was National Voter Registration Day. If you're not registered to vote, the deadline to register is October 13th. So if you're planning on voting and waiting to get around to registering, you've got to the 13th. Please get that done. And there are also going to be ballot drop-off boxes available around the county. Drop-off box information, installation dates and locations will be included when you get your mail-in ballot. So that'll be additional information that you'll get to tell you where you can drop off the ballots, which isn't necessarily limited to the voting places. So I will stop there, and I'll turn this over to Dr. Gales.
Good afternoon and happy Wednesday to everybody. Always a pleasure to be with you, and as always, hope that you and your families are staying safe. I do want to take this opportunity to make a couple of brief comments and open the floor for questions. First, I want to say a tremendous thank you to all of the respective teams and agencies who continue to work on this response. In a host of different meetings this week, we've talked about how the response has been a little bit more sustained than any of us originally thought, and will probably be sustained for some time to come. So I just want to take advantage of this opportunity to say thank you to all of the different employees and staff members across the county agencies and the different organizations within the community who've been a part of the response. And a special thank you to the staff of the Public Health Services team, who I happen to oversee, for their countless hours and endless dedication to keeping the residents safe. A couple of announcements. Want to highlight flu shots. Get your flu shots. As County Executive mentioned, he got his this week, and we encourage folks to get those as early and as soon as possible so that we can get as many people protected from the impending and upcoming flu season. Also, we want to highlight that we are encouraging parents, even though most of the kids are not physically in school, we are still encouraging parents to get their children's immunizations up to date. Because the reality is, at some point, we will return to in-person schooling, and your children will need to have those things up to date in order to move forward. Now, we do have vaccine clinics that are supported by the county for children to get caught up on their routine immunizations. They are open Monday through Friday from 8:30 to 4, and the two sites currently are the Dennis Avenue Health Center and the Germantown Area Health Center in Up County. And we're looking at other potential opportunities to offer some additional sites to provide that service to families for their children. We also want to just update a topic that we talked about last week. Dr. Stoddard and I continue to provide some workshop services for the non-public schools. We had another meeting with them on last Friday. Since our conversation last week, we have had a number of other schools pop up with COVID-like illnesses that necessitated quarantines and further action. And we have had another school meet the criteria for an outbreak based upon the state's definition, which gets us to 2 schools now. We will continue to investigate those and provide guidance to those respective communities and support them in whatever way that we need. We continue to get further guidance and have deeper conversations about potential vaccine dissemination strategies. We still at very early stages in those conversations as we await more clarity in the guidelines and distribution strategy from the federal government. But I did want you to know that we are working on that both at a state level as well as a regional level, so that when we do get a successful vaccine candidate or candidates, we will have a robust strategy in place to be able to disseminate it to all of our residents. I'll stop there, but happy to answer any questions you may have. Thank you.
Dr. Stoddard, any opening remarks?
Yeah, good afternoon. Just a couple, just to touch on, as we saw with the executive order yesterday, we did work with the faith community to develop additional new guidelines. We know that a number of the high holy days are already starting, and many more will come over the next several months. They were looking for some additional capacity to support those high holy days, and we were willing to accommodate that request based on some additional recommendations and other things to offset some of the potential risk of having more people by having, making other things around the periphery of the faith practice to be safer. And so we worked on the guidelines with them. They reviewed them, and I think we came to a pretty good place as far as increasing capacity while also making it as safe as we possibly can. I'm sure many of you will be in to ask about Halloween guidelines. The public health team has developed a set of guidelines based on what's out there nationally. However, we are working with our neighboring jurisdictions to get everyone on the same page with the language so that we're all being consistent across the board. So we'll likely be releasing those very soon and have them be well connected with what others in our neighboring jurisdictions are doing as well. The last thing I want to note is September is Preparedness Month, so obviously for emergency management, we're focused on a lot of things that go beyond COVID. But even within the COVID realm, we are doing a lot of preparedness. And so the county has been preparing for a potential for a second wave or a second increase in the fall. We've been stockpiling personal protective equipment. We're now sitting at nearly 4 million N95 masks. That stands in stark contrast to the 30 or so thousand that we had before COVID-19 existed. And so obviously we're in a substantially different place. We feel very comfortable about having enough personal protective equipment for our first responders, police, fire, correctional facilities, our congregate living settings with our shelters, and also the ability to support, if necessary, our healthcare institutions should they be overwhelmed as they were in the fall. And so it is Preparedness Month. We are preparing for a second wave of COVID-19 as a county. We're also expecting our partners to be doing the same thing and have encouraged them to be similarly stockpiling resources. If I'm sure many of you are aware of what's going on in Europe, the cases per day in Europe are higher than they were in April and May in many countries. I think it's really important context for us to be concerned about. There are certainly places across the United States where we're starting to see increases as well, and that's something we're monitoring very closely. And so we're preparing for any eventuality. We're hoping that it ends up not happening in the United States, but we'd rather have the resources and it not happen than it happen and not have the resources. So I'll stop there.
Okay. Thank you. Now it's the time for the questions, the Q&A, and reporters, remember to place your request on the chat. The first question comes from Robert McCartney from the Washington Post. Robert?
Hi, question for Dr. Gales. The county executive mentioned that there's been a drop in people coming in for testing, and I'm wondering what explains that, and in particular, are you seeing some drop-off in public, interest in complying with what the county's trying to do? And related question, is that showing up possibly in cooperation with contact tracing? I mean, the district has said that their numbers they put out on contact tracing in terms of people, what percentage of people were willing to cooperate was well under 50%. And I'm wondering if you're seeing the same kind of disinclination in Montgomery County as well.
Thanks, Robert, for your question. So the first question in terms of testing, we have seen and have had some concerns about decreased testing volume across, not just in Montgomery County, but across the state. Our numbers have actually leveled off and improved over the last several weeks, but it has been concerning because there have been multiple days, for example, where we have had state test totals reported. I think there was one day it was as low as 9,000. I think today it's somewhere around 19,000. There have been some others where it's 12, 14,000. Also in the setting of, some higher volume days where we're seeing 24 and 25,000. The reason why this is a concern and alarming is because in, late July and August, or throughout July and August, we were averaging probably somewhere between 25 and 30,000 tests reported on a daily basis. We think that there are a number of factors that have influenced the volume issue. The first one, as was discussed, was that there was some confusion that we think was caused by the CDC's guidance that they put out some weeks ago stating that only symptomatic folks should get tested. And we think that may have influenced practitioners in terms of their willingness to test individuals outside of those definitions. We also think that it influenced consumers hearing, will say, well, maybe I don't need to get tested if the CDC said this. Now, unfortunately, we have learned that that guidance was not necessarily, well, that guidance was not driven by healthcare providers and officials within that. And since then, that information has been reversed, and they are recommending that all folks get tested. But we do recognize that that created some confusion, even though we said as a county that we were continuing to enforce and emphasize that all folks should get tested. So we think that influenced that to some degree. We also think that there is potentially, this is part of a larger COVID fatigue. So folks coming in to get tested less, concerns about folks adhering to physical distancing guidelines and face covering guidelines universally. And it's a topic that we are looking at very closely on a local level. I can tell you that the state is also, Deputy Secretary Chan and Secretary Neal are also looking into it to look at how we can review it on a state level. What is encouraging, though, is that we do see, particularly here in the county, we do see capacity at comparable to where we were in early August at our highest points, where we saw, potentially thousands of folks coming in. The concern is that we're just not having as many people come in and fill those slots. So we're on it, and we're thinking through it, and we're looking at how we can improve access as well as get that number back up. Now, on the flip side, as it relates to contact tracing, we have not seen a comparable decrease to the level that you've described in the District of Columbia in terms of compliance. And so we will continue to monitor those trends. In fact, just before the call, we received our weekly update in terms of performance measures we get from the state in terms of how many folks we've contacted, how quickly we've contacted them, and what percentage of those have we completed, full contact investigation interviews.
Thank you, Dr. Gales. Next is Kate Ryan with WTOP, and she has questions for Dr. Stoddard and also for you, Dr. Gales. Kate?
Unmuting. Dr. Stoddard, one of my first questions is expansion of alcohol sales after 10 p.m. You were asked about that yesterday in one of the hearings. What is the status of that? And for Dr. Gales, are there no cases of COVID at public schools? I know they have some students in some of the daycare and rec programs. And how many contact tracers has the county actually employed?
I'll start. So we do have a draft proposal that we're vetting right now for expansion of the alcohol sales from 10 p.m. to midnight. I do want to make clear, though, that we're being incredibly scrutinous of this proposal for a couple reasons. Number one, as the CDC guidelines that were briefly launched, and we frankly agree with, and the world agrees with, aerosols are a problem, and we're going to apply greater scrutiny to almost any circumstance that has people indoors congregating, and in particular places like indoor dining and indoor alcohol consumption, where a face covering cannot be fully worn for the duration of the time inside. And so it's not to say that we're not going to do it. It's just we want to be really careful and scrutinous about the programming and the consequences for people who don't follow the rules. And so I think that's really what we're cleaning up. I would expect by the end of the week we're going to have something on that issue, but we're doing our due diligence to make sure that it's exactly what we want it to be before we go live, because we don't want this to be an area where we make mistakes.
Got it. And Dr. Gales?
Sure. Thanks, Kate, for your question. So we have the reason why I reported the numbers in terms of the non-public schools relates back to a question that was asked in one of our previous briefings. And we reported it because those were asked, but then the non-public schools are actually have gone back to school in different capacities in terms of in-person and hybrid learning situations. So that's why we reported those numbers that way. So MCPS has not been in session in terms of educational opportunities, and so hence there have been cases that maybe have involved MCPS staff or students separate from their school setting throughout the pandemic. But at this point, we have not had any reported for example, that would require to quarantine other staff or additional students in that setting because they have not gone back to in-person learning at this time. Now, as it relates to childcare facilities have been open throughout most of the pandemic. And yes, there have been cases related to child care facilities across the spectrum, regardless of the type of facility. I don't have those numbers in front of me at this time, but we could have a separate conversation to talk about what those particular numbers look like. But that gives you some context in terms of why the numbers have been reported, secondary to the questions that have been asked recently.
Well, I would also note one additional point to that. So the Montgomery County Public Schools and Montgomery College and the University of Shady Grove do participate with the non-public schools on our education recovery mission area. And so they are meeting on a bi-weekly basis. And actually this week's topic is sharing of best practices with some of the non-public schools to Montgomery County Public Schools and the university systems to see if there's lessons that can be learned for how Montgomery County Public Schools, when they ultimately move into their hybrid model, hopefully the cases are lower at that point, but when they do, what lessons the non-public schools who have attempted the hybrid learning so far have come to.
Randi Bass with WDVM has a question for the county executive. Randi?
Good afternoon. Thanks for having me on the call today. Question for you, County Executive. I understand the county is capping indoor dining capacity at 50%, restricting alcohol sales. Are you worried about the fate of restaurants who are relying on space provided by outdoor dining, streeteries, things of the like to keep their doors open as we head into the cooler and colder months? And is the county prepared to provide them with additional support and assistance?
So I'm worried about everything, and it is impossible to simply worry about the fate of restaurants and not worry about the fate of the human beings who can get sick, die, or be permanently affected by getting the COVID virus. If this was a simple, would you open businesses up? You would get a simple, of course you'd open businesses up. But whatever we're doing in the context of whether or not we can keep people safe. So I am well aware of the challenges. I went up this last weekend and talked with Steve Nugent, who I've known for years, who owns Harp and Fiddle, and they're closing. And it's a really sad thing that Harp and Fiddle is closing. His landlord will give him absolutely no break on the rent he couldn't possibly pay because he had no customers. And so he's accumulated a large amount of debt. Whatever he was able to get from the federal program, and certainly from the county program, isn't adequate to cover his back rent. And so I imagine there are other people who are in similar situations. But at the end of the day, we have to make decisions that keep the public safe. And most important right now, with everybody worried about what happens if there's a fall rebound in cases, we need to make sure that we are less exposed or as little exposed to a rebound as possible, and that we're doing everything we can to generate as few cases as possible. So as Dr. Gales has alluded to, indoor and outdoor dining both have risks. They are some of the highest reported activities among people who tested positive for COVID. So the opening and further opening, as the governor did, without adequate precautions, and I'm not sure what you can do adequately beyond what we're doing right now, just simply puts more people at risk. And as good as our county numbers are in some respects, our caseload per 100,000 is still too high. And there are parts of this state where their caseload per 100,000 is close to 20, which is way too high, is not considered safe in anybody's imagination. And, it leads me to wonder about statewide orders. I mean, I would be much more comfortable if decisions were made based on local conditions rather than just simply saying the state should do X. And lastly, I'll say, and I said this last week, if our numbers were more like New York, New Jersey, and Connecticut in terms of positivity and in terms of cases per 100,000, we'd be having a different conversation. But our numbers aren't anywhere close, particularly in cases per 100,000. And so that leaves us, in a category which we still think is too high risk to open more things. So it's a long way of saying I've got other things to weigh beside the business impacts. If I do the best thing for business and it winds up being the worst thing for the community, the cost and damage done by letting this virus get loose again the way it was before will make all this pale.
I'd like to add one point too. I know DC a couple days ago did announce a winterizing outdoor patio space grant program. That is something that we are looking at with our reopening grants as well. And so we may, that was brought to our attention. I think it's a really, really creative idea for how we can do more outdoor dining space even throughout the cooler months. And that's something we will be looking at to see whether we can make that work as well.
Rebecca Tan with the Washington Post with questions for Dr. Gales and also for Dr. Stoddard. Rebecca?
Thank you. Dr. Stoddard, you mentioned that the county is preparing for possible surge of cases in the fall by stockpiling some protective equipment. I'm wondering whether the county also has a plan in place for what happens in terms of possibly rolling back restrictions. Does the county have a sense yet of what activities would be curbed and whether there might be another stay-at-home order?
So the short answer to your question is yes, we are definitely looking, and Dr. Gales can speak further to this because I know he's been working specifically on this. We'd like to be able to give people a picture of a more simplistic picture of what it would mean to move forward, and also what would happen, at what point we would think about moving backwards. And I think that would be where we'd like to be able to talk to the community about, in order to move forward with a phase 3 or more openings or more things, here's the numbers, a more concise set of numbers that we feel like would be a target for that. But on the other flip side is, because we're in this sort of, a fork in the road, as it were, we want to be able to say, like, if we go this direction, we'll be able to open up more. Unfortunately, if we go this other direction, that's where we may have to talk about closing things. But as far as a stay-at-home order, that's not something we have necessarily talked at all about at this point. We just want to understand, and we want the community to understand what we're looking at in terms of ways that we would move forward or move back. And I think we're going to be talking more about that over the next, coming days and weeks.
So consistent with our approach that we've taken so far and has been demonstrated by the actions that we've taken in terms of opening up activities, or as was referenced in one of the earlier questions, the provision of walking back, allowing alcohol to be sold at certain times. Any of those decisions would be driven by the information and data that we have available, particularly looking at contact tracing data that demonstrates that there are particular activities that may be tied to higher risk of transmission, and also activities that are tied to the cases that are turning up positives. So we will continue to look at that data, and if there are activities that we need to rescind in terms of their opening status, that's the kind of information that we would use to drive those types of conversations. Now, very similar to how we discussed it in relation to school settings, is big factors that would drive those conversations are related to, again, the impact of community transmission. We know, and it has been demonstrated very clearly from the guidance that has been provided from CDC and a number of other entities recently, is that the success rate of being able to open up certain activities is significantly influenced by what the rate of community transmission is. So there are a host of measures and metrics that approximate that, including test positivity, cases per 100,000, also looking at the impact and influence of our hospitalization rates and those kinds of things. So we will continue to look at those things and continue to use the data to guide those decisions and make those determinations.
Kevin Lewis with ABC7 has a question for Dr. Gales. Kevin?
Hey, Dr. Gales. So just delving a little bit further into daycare and child care facilities with cases. I know you don't have specifics, but can you give a little bit more detail about that, since there was a decent amount of coverage of it leading up to the beginning of the school year?
I don't have the data in front of me to be able to inform that decision. I'd be happy to talk with you offline once we've had a chance to get the specific numbers, to also be able to break that down and answer your question more thoroughly.
Okay, I'll follow up with your office then about that. And then, County Executive Elrich, with regard to some of the fiscal projections for the county, I know those reports have come out in the last week or so. How are you looking at this moving forward? Are we looking at tax increases? Are we looking to potentially make cuts to county government?
Well, we were really careful about what we did in the beginning. I'd say one of the things we did was not panic. And we looked very closely at the revenue situation, and I felt pretty sure, because of the unusual nature of the federal unemployment program, that we would see less of a hit in income tax revenue than we originally anticipated. I don't know how much anybody knows about unemployment payments in Maryland, but the average unemployment payment was about $400 a week to somebody. And the federal government added $600 a week for, I guess, almost 3 months. And that significantly increased incomes, and all that income was taxable. So we're not going to see the kind of total and complete fall off of revenue from unemployed people that happened during the Great Recession. And knowing that, at least counting on that being true, we did not make drastic cuts early on, because we thought we'd be in a better position to manage this, given what we knew about how the taxes would come in. And it turned out that we were right. We're going to have less revenues probably than we anticipate total for 21, but it's not going to be, I don't think it's going to be a deal breaker. The bigger challenge is the budget we create for 22, which is the budget we'll send to the council in the spring, because the income taxes were based on the income up through December 20th of this year. So we're going to wait to see what those numbers look like. We're looking at the withholding, which is kind of a surrogate for the actual taxes. Withholding tells you basically how much money's being earned, roughly, because not everybody gets withheld from, but it gives you a rough idea. And we'll make decisions as we get closer to, December. But, we don't want to precipitate a massive reduction in services, or, necessarily raising the taxes if we don't have to. So we're trying to manage this as best we can. The other thing we're doing is, we're looking at how we make changes in county government. I talked about wanting to do restructuring before I got elected. Some people think it's an easy thing. You walk in and you just, fire people and clean places out. That's not how you do thoughtful restructuring. So we're going through a process. We're actually going to be evaluating jobs and whether we need every job we have, starting with the jobs, frankly, that are vacant right now, which is a large part of our workforce. We have not done hiring, I think, since March, except in emergency or critical use situations. So it gives us an opportunity to look at lots of the county government and start figuring out, do I need to replace every job that existed before COVID came into place? Just like, we're teleworking now at a scale that we never imagined was possible. And, I was a proponent of teleworking. When I came here, almost nobody was teleworking, even though the county policy said people could telework. Now we find that most of our workforce was teleworking, and it worked pretty well. That has implications for operating costs, it has implications for how much office space we have to occupy. So there are a lot of things that are going to keep moving. So we have our eye on COVID in the moment, but we're also looking at how budgeting evolves over the next couple of months. And I think we've got ways of avoiding drastic cuts, at least this year, and we'll see what it looks like as we go into creating the budget for next year.
And as the county executive has alluded to many times, there are 2 ballot questions on the ballot in November that will impact that long-term outlook substantially.
Yeah, so I'll be more blunt even though, we're supporting question A, which still requires the 9 members of the council vote for a tax increase, but it gets us out of the shackle where we're limited to the revenues we raised last year, which ironically doesn't limit any individual's tax increases. One of the perverse things that we found when we start digging into this is that if you got a 10% increase in your assessment, you could get a 10% increase in your taxes. That tax revenue, however, doesn't go into increasing the amount of money that the county collects. It just means that your additional 10% requires us to cut somebody else's taxes so that the total amount I raise doesn't exceed the revenue cap. There is nobody in this region that operates that way. And our Northern Virginia counterparts have, a totally normal tax system where increasing assessments give them the freedom to either leave rates alone or slightly reduce rates depending on how much additional revenue it kicks in. But they've got choices. Under our current system, we have virtually no choices. And so if we get the worst of all scenarios come this year and we discover that a bunch of commercial property is appealed for reassessments and their tax bills go down and our collections go down, coupled with the decrease in income taxes, we are at the maximum of the tax rate on income taxes. We could wind up, and with no inflation, because you can be pretty much bet that this year is going to be no inflation. We could easily get a 0% inflation rate applied to a declining tax collection, which would mean the county would be hamstrung into not having any money. And if Robin Ficker's proposal passes, not even 9 votes on the council would be sufficient to do something with taxes. It becomes impossible to do anything with taxes. So I've told people, if you want a sleepy little bedroom community that can't build transportation and can't build schools, then the path we're on right now, perfectly fine. We'll just simply disappear off the table. We won't be a player in anything. And if people expect us to grow a tax base and meet additional needs without having to, we won't even be able to raise taxes if Ficker gets in there. If you expect us to be able to have a more robust county that addresses the needs that people have, do the transportation and schools that people want, then we need to have an option like option A. We can't keep doing what we're doing.
Okay. We have another question from Rosbelis Quinon with Univision Washington. Rosbelis, do you want to ask the question, or do you want me to read it as you wrote it on the chat?
Hello. Hi, can you hear me?
Yeah.
Yes.
Yeah, hi. So I'm just wondering, because you are being telling us that people are getting less tests, coronavirus tests, and I'm just wondering do you think that this has something to do with what happened with the testing sites that were closed? Maybe people, this affected like people's confidence on the test, or do you think it's just plain that people is getting tired of getting tested?
Well, I think certainly, that could be a factor and influence some folks in terms of their willingness to come into the county sites. However, when we're talking about decreased testing, it's not just been us experiencing it here in Montgomery County. It's been something that we've seen across the state, to some degree across the nation as well. But we continue to look into ways in terms of how we can improve what we offer. When we had the issues with the testing that you referred to, since then we have worked with new labs, and we also have worked to make our process from registration as well as notification of results, which were areas that were concerns about the experience before. We've worked to improve those significantly to make sure that they aren't, that those who do utilize the county testing platform don't encounter any of those issues that they may have experienced before.
I think we talked about before, the county testing is somewhere between 7 and 10% of the total test volume on a fairly regular basis. The reductions that we're seeing on some days are 33, a third or more reduction. So certainly it could be a contributing factor in some of the county testing reduction, but it could not explain the broader across the board reductions that we've seen. It's just the numbers wouldn't add up that way.
Okay, thank you. We do not have any more questions or requests for questions on the chat box from reporters. Reporters going once, members of the media going twice, 3 times. Thank you, Dr. Gales. All right, well, thank you, everybody, for joining us today. And as every week, we should be back next week. Have a great afternoon and stay safe. Thank you.
Thank you all.